morning, friends. This is Dr. Murugesh. Previous episodes, I have given adequate emphasis on walking and what is to be taken care of while walking. This episode, I will highlight on the pre-walking preparations to be done before a person decides to walk. You may wonder why you need a pre-walking preparation. As you all know, we started walking even when we are in the womb, the mother's womb. By 8th month, we started kicking around. Then as soon after birth, by 6 to 8 months of age, we started crawling around. Then by 10 to 12 months, we started standing with support, first with the chair. Then we started slowly walking off our own, then started climbing stairs. So as we evolve, we started running around and started playing. But as we started our professional work, we are less mobile now, as I said before. So we need a structured program to get back our mobility or to get back the benefits of walking. At the same time, a few people, say 2% of people, should be cautious before they start a structured walking program. 98% of people, there is no problem. They can move around, they can follow the structured program, which I am going to elaborate in my next episodes. But only these 2% have to be careful, have to take note of certain things before they start their walking schedule. Who are these 2% people? People who are breathless on exertions. If they start moving around, if they have a difficulty in breathing, people who develop chest pain when they start walking, people who develop palpitations when they start walking, people who have giddiness, dizziness, lightheadedness, severe headache, or a non-epileptic who is supposed to throw fits once in a while without any warning, or an epileptic who has episodes of loss of consciousness. So such persons have to be very careful, especially an epileptic with episodes of loss of consciousness. He should not walk in the road alone, because when he falls, because during his loss of consciousness stage, he may hit and develop some grievous injuries. So it is better these people are cautious. They have to done previous medical workup before starting the program. Either they can consult a cardiologist or a neurologist or whoever their family physician is, assess their cardiac status, the respiratory status, and the neurological status. It is advisable even they can undergo a treadmill test to know their walking limits, and only with the concurrence of the physician or the cardiologist or the neurologist, they should adopt the walking program. So some people who are, say, in cardiac failure cannot tolerate walking even for a few steps. For such persons, we don't advise walking. See, some people, especially elderly with severe arthritis, severe knee pain, they won't be able to move around. Such persons also, we don't advise them. Or a severe diabetic who goes in for hypoglycemic episodes often, who is on insulin, should be very, very careful before adopting a walking program. Or a person who is not on medication, a diabetic not on medication, has gone in for complications such as diabetic ketoacidosis, he should not walk without the consent of his diabetologist. So better do a pre-medical evaluation before starting the walking program. For that, you should do a treadmill testing. You should take an ECG, especially if you are more than 40 years old. If you are a diabetic, take a basal blood sugar level. If you are hypertensive, take a basal blood pressure level. If your basal blood sugar level is very low or very high, don't walk. If your basal blood pressure level is more than 180 millimeters systolic and 120 millimeters of mercury diastolic, please don't walk at that time, because the very activity of walking can increase initially the blood pressure level, which can cause problem. Elevated blood pressure above 120 can cause a lot of problem. So such people, be cautious. I don't say don't walk, but be cautious. Be aware of the consequences, and then with the consent of a physician, with his guidance, you walk. Especially diabetic, he should know the following things before. He should take care of the following things before he starts a walking schedule. It is better a diabetic carries an ID card with him with the drug details if possible, then carry a mobile, and he is not allowed to walk alone. Preferably he can walk in a group. Then he should know when was the last time he took his food and his medication. A person should not walk immediately after food generally. We advise walking at least 4 hours after his last meals, because only then he will have the agility and fitness to move around easily. If the stomach is full, the agility will decrease, his walking speed and benefits may decrease. So the diabetic should especially know his last meal time, because he is prone for another problem called hypoglycemia, wherein the blood sugar level will fall down less than 80 milligrams per deciliter. So that is why I said better check the basal blood sugar level before a diabetic starts walking. If the blood sugar level is low, say less than 80 milligrams per deciliter, he is allowed to take say 15 to 30 grams of carbohydrate in the form of sprouts or in the form of an edible salad or a health drink, half cup of health drink or 2 biscuits, anything of his choice. Let him take 15 to 30 grams of carbohydrate before he starts walking. Then he should also be aware of the medications that he is taking, especially if he is an insulin dependent diabetic. Never take insulin before you start a walking program. You should take insulin only after completing your walking program, taking a bath, then relax for some time. Then before you take your breakfast, take injection. Don't take insulin and then start a walking program. If you are on oral hypoglycemic agents, that also you don't take the drug before you start a walking program, because the peak action of all these drugs are 1.5 to 2 hours after it is being taken. And suppose you are a long distance walker and in the midst of your walking schedule, you may have the peak action of these drugs, either the insulin you take or oral hypoglycemic agents you take. So you are more likely to experience hypoglycemia, which is more dreaded than hyperglycemia. So a diabetic, I repeat, emphasize again, should carry an ID card, should carry a mobile. He should know when he took his last meal. He should know what is the medication he is on, and he should know the peak action of that medication. Better not to take the drug or inject insulin before starting a walking program. So once he goes for a walking program, comes back, sits, relax, sleep, there is another chance of developing hypoglycemia 1 hour after, because when he walks, first the glucose gets utilized as a source of energy. Then the glycogen that is stored in the muscle is used as a source of energy. And after his walking program, he comes and takes rest. The muscle try to rebuild the glycogen that is being utilized previously. So that is done by mobilizing the blood glucose level. So even 1 hour after the walking program, he is likely to develop hypoglycemia. So aware of all this. I'm not saying all will get, but you should be aware of such physiological consequences because of walking. So if you know what is going to happen, then you can prevent it from something, because we are walking to get the benefit. We should not get injured, or we should not get harmful effects because of the walking program that we have undertaken just to improve our health, right? So that's the point I want to drive. Next, it is always better to walk in a well-lighted area. Morning walking period is more better than walking in the evening, because morning the atmosphere is fresh, the oxygen content or saturation in the atmosphere is maximum, so you get the maximum benefit out of walking. Then you are fresh and your schedule will be consistent. You won't break it. If you are having an evening walking program, you may have a sudden appointment or some other change in work, your boss may tell something, you are most likely to skip. So a person who wants to be consistent or persistent with his walking schedule, it better get up early, 1 hour early, and start walking in the morning, where the atmosphere is fresh, you are mentally fresh, then there is no pollution or traffic around. Then once you walk, you get all the benefits from the atmosphere, and you become fresh, and the energy flows through the day. It's as if you have started or begun your day well. If you listen to all successful people, entrepreneurs, politicians, leaders, they have a very good morning routine, and that morning routine includes a basic exercise program. So that 45 minutes or 1 hour, a good beginning in the day, the energy flows through the day. You can plan your day, and when you walk in open air in the morning, fresh air, you will feel as though angels are whispering to your ears. You will feel fresh, come back, then you will meet friends, talk to them, have a hearty laugh, come fresh and start your day. And always move against the traffic. In India, the traffic rule says keep left. For walkers, it is keep right, so that you are aware of the oncoming traffic and prevent yourself from getting hit by them. So always keep right, move in a well-lighted area, move in groups, carry an ID card, and if you are elderly especially, inform the people at home which route you are taking, when you will be coming home, and all your program, let your family be aware of what is going on, so that anything they can come to your rescue immediately. Then as you walk, we have a target in our mind. I have to walk for say 60 minutes, 90 minutes, or we have a distance as a target, say I reach 5 kilometers, 6 kilometers. Good, set a target and walk. But it's not necessary you should complete your target always. Suppose in between you get breathlessness, chest pain, syncope, dizziness, lightheadedness, headache, then don't continue walking. Stop walking, wait for 5-10 minutes, relax. If you are relieved of your symptoms, then start walking. But even after that, your symptoms are not relieved, you get aggravation of symptoms, better stop walking. So have all these pre-medical advices in your mind, then start walking to get optimal benefits of walking. Thank you.